Imagine waking up one day, your life completely upended by an illness you never saw coming. This is the stark reality for millions in Britain, where long-term sickness is forcing people out of work at an alarming rate. But why is this happening, and what can be done about it? Take Roni Jones, a former NHS manager and self-proclaimed workaholic from Cornwall. 4 years ago, she collapsed in her garden, only to be diagnosed with multisystem dysautonomia, a debilitating neurological condition. Once dismissive of those off work with long-term sickness, she now finds herself among the 2.8 million people in Britain unable to work due to chronic illness. There's always been this negative stigma around not working, she reflects, until it happened to me. Her story is a powerful reminder of how quickly life can change, and it raises a critical question. Are we too quick to judge those who can't work without understanding the complexities behind their situations? The numbers are staggering. Since 2019, there are 800,000 more people of working age off work due to long-term sickness, a 40% increase. Mental health issues and musculoskeletal conditions are the leading culprits, but the reasons behind this surge are far from simple. And this is the part most people miss. It's not just about individual health. It's a complex interplay of economic pressures, workplace culture, and societal trends. Mental health, for instance, is the single biggest cause of long-term sickness, accounting for 28% of cases last year. But here's where it gets controversial. While reduced stigma has encouraged more people to seek help, rising economic insecurity, the pandemic, and the relentless pace of digital work are exacerbating the problem. There's been a really big drop-off in young people transitioning from education to work, notes Mark Rowland of the Mental Health Foundation. That has a terrible economic and social cost. Is our fast-paced, high-pressure work culture to blame, or are there deeper systemic issues at play? Musculoskeletal conditions, the second most common reason for long-term sickness, disproportionately affect older workers aged 50 to 64. With an aging workforce and declining birth rates, this trend is unlikely to reverse anytime soon. But it's not just about age. NHS waiting lists, which stood at 7.4 million cases in August, are compounding the issue. When you're waiting in pain and you're working, it's going to affect your physical and mental health, says GP Adrian Hayter. Should the government be doing more to address these delays? Or is the healthcare system simply overwhelmed? Workplace culture is another critical factor. Heavy workloads, lack of flexibility, and poor management are driving stress-related absences. Not enough employers are training their managers to manage people properly, says Ben Wilmot of the CIPD. It shouldn't be rocket science that managing people is important. Are employers doing enough to support their staff? Or are they expecting too much from GPs and the healthcare system? The government's £1 billion Connect to Work program aims to help 300,000 sick or disabled people back into work by 2030. But critics argue that prevention is key. Our system invests almost nothing in prevention and support at the early stage, says Rowland. Countries like the Netherlands and Australia offer financial incentives for employers to invest in health prevention and reintegration programs. Could Britain learn from these models? Or is our approach fundamentally flawed? As Roni Jones poignantly puts it, what do you do to us when you think all of us are malingers? Come live my life for a week. You would break your heart, because I have. Her words challenge us to rethink our attitudes and take action. What changes do you think are needed to address this growing crisis? Is it time for a complete overhaul of how we approach work, health, and societal support? The conversation is far from over, and your voice matters.